Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk some more about Class 3 cases where we remove the lower 6-year molars. It helps correct the upper arch also. You use up part of the space correcting the relation on the bottom, and the other part of it you pull it forward by bringing the upper anterior teeth forward. You pull the lower teeth back like this with Class 3 elastics, and that brings the upper teeth forward and gives the tongue a little more room in there. So let's get going on this case. I've got a lot of slides on it, and we tried to I went over this with the parents, and they said, let's go ahead and do it. I went back to the dentist that sent the person to me, and he said, I'm not taking out those 6-year molars, which is the normal reaction of the dentist. And so they came back to me, and I went over it again. They said, well, we see this is what we really ought to do. And so I called the guy, and I knew him very well. I saw him at dental meetings, and I said, do you mind if I have somebody else take the 6-year molars, the lower 6-year molars out? And he said, no, I don't care, but I'm not going to do it. So I got an oral surgeon to take them out, and they didn't bat an eye. They just went ahead and took them out. Now let's go through this case, and I want to show, I've got a lot of pictures on it. There are several other things wrong in the case. So we'll go ahead and get going on that. Now, this is a nice little girl. My voice is getting worse the older I get. She's got her eyes kind of closed there. No big problem, but you can see the Class 3 problem. We had the lower teeth extending out past the upper teeth, and then her upper cuspids were kind of impacted in the room, and that helped you correct it also. So in correcting the lower arch, we just corrected a lot of the upper arch too, not just the correction of the cuspids coming in, but also the widening of the arch. You'll see that this upper arch, and if I can show you, the upper arch is inside, the lower arch is out past it, and this is end to end right here. So we're going to have to widen this upper arch, and we do that with a palatal separator, or I could have done it with this Big Daddy arch wire in there, but back then I wasn't too familiar with the Big Daddy, but this is 1986. We could have done it with that, but we used a palatal separator to expand the upper arch, and we take out the lower 6-year molars now. Now we're going to use part of this to bring the anterior teeth back, and in other words, we're going to have a big space in here. We're kind of going to bring these teeth down here back to somewhere like that, and then we're going to bring these forward up to here. And so we do that by pulling this, not this way. We pull these teeth forward, and it pulls these teeth forward, and that pulls these teeth back even further. So we pull the two together till we get to a certain point, and then you pull the rest of the space by going down to the front teeth from the upper back teeth. And that brings the maxilla forward right here. All right, let's get going here. The other side of the case is same way, same problem. We used a palatal separator to go in, and we banded all these teeth right here. Everything we band, and we cement those in solid, so when we expand this out, the teeth go bodily. You don't push them out. If you put just a bar in here and push on it, the tooth will lean this way, and the teeth, the roots of the teeth will actually move lingual when you do that. So if you have it rigid, it goes out there. It may tilt a little as it goes out, but you stay there several months and the occlusion will bring the roots out with the teeth. And you will see we're going to end up with these upper teeth being over the lower teeth like they should be. And so let's get on with it. There's a lot of stuff to cover in this type of work. And now we go in and we put a palatal separator in. I think we've got it in there now, and we're going to open the space here and bring these cuspids down in this groove. And our midline is lined up pretty good with a little flexible wire in there, and we're pulling back on one side to make some room for some teeth in this area right there. All right, we're pulling the cuspids down into that spot. And you can see we go in with the palatal separator and put that in, and we'll open this thing up completely and bring these teeth out. Now, and you can't push these and not push this, so we carried this out and held it, and now we come back and bring these teeth out to match that. So let's go here. We're pulling back now with some chain, elastic chain. We're pulling these teeth back to make some room in this area. So we're going to pull these teeth back somewhere along in here, and then we'll we'll come back now and pull these teeth back, pull all these teeth to match that. By pulling the upper teeth forward, we'll pull all of these back. That'll get that straight for you. All right, here we go. Now we're going to take out a 6-year molar. People call it and are writing it with the bone. Can you move the bone up here? You can move this bone, and I'll guarantee you can show it to dentist anywhere you want to. They'll think they'll take this tooth as a 6-year molar, and somebody's extracted the wisdom tooth, where this is coming in, and you can do that. If you're worried about the bone in there, if you just ease that tooth along, you can bring that tooth up here. But you come in here with an arch wire with a loop in it, and it goes down. I'll show you how we do that on this case. Okay, we're going to take the 6-year molars out, and we're going to keep these 2 molars and bring them into this area. And we've got the palatal separator now. We've got these teeth out in that area. Now here the 6-year molars are gone, and we're going to straighten them up, and we're going to start bringing these teeth bodily forward. Now, to do that, we started off pulling too much here, and we tilted this tooth over. See, look at how that tooth was to start with. Don't do that, because you rotate how these roots are further back than they were when it started there. So you keep the tooth straight up and down and bring it forward into this, and so the roots are with the crown as it comes out. Now we cut the palatal separator off up here, and that left that, so we put a wire in there if we need to bring that back. All right, we come back and correct this. And what you do there, you put your arch wire comes, let me just draw you, this part of the arch wire here would be going down. You come over like that, and you make a loop this way, and now you bring it off here. And so you pull this up, and it pulls, this part pulls on the root. It'll be straight here. It pulls the root forward. At the same time, you pull the crown back. And this is something people need to learn how to do. And you bring that, it'll straighten that tooth up and pull it right up in that place. All right, you see this tooth now is straight. And there, that had that little spring part put in there. we pull this one together and it's straight up and down, and we can pull it back. You can pull these roots right up here if you want to. You wouldn't be any reason to do that, but you could do that. All right. We're going to have to hold this tooth up now. You make darn sure you got an arch wire going back through there that's down enough to keep that tooth up there while we let the wisdom tooth come up against these teeth up here. Now on this side we got a wisdom tooth that we don't have one below, so it's just probably going to lose it. Now we've got that straightened out. Now here we'll pull that in, and you'll see that second molar, this wisdom tooth down here, we got to hold this tooth in that position till you get the wisdom tooth up here underneath it. So you need to band or hold that tooth up with some form of retention to it. All right, we hold that there, and we're letting this erupt up as it comes along. This is 1991 right here. And she's got this tooth that there's nothing for it. It won't touch anything. This tooth is back over it there. Now let's speed through here again. We got it to one side. We opened it, but we're going to level this out. Now here we had to bring these bicuspids out after we took the palatal separator off. Now this is the little spring that we put in, and it's go down. You put that on a tooth, and you tie from here back here, and it'll bring the roots. It makes the roots of the teeth come with the crown. That's a trick you need to learn. I'll show that again, I think, over here, how we brought these bicuspids out here after we took the palatal separator out. We cut it off and left this in there, and we moved this out to bring the second molar out. All right, this is 87, 80, they couldn't see that picture, but this is the side. We've got a class 1, these cuspids now coming right down in this groove. Now we'll back, and you see that spring again in here. It's coming, you can pull those roots right up against the other tooth if you wanted to, and make them go any way you want right in here. See this, like that, and that was down that way. Now that's a bad picture, but you can see the palatal separator. Now we're closing the rest of this space, and we've got this, there's that little loop, you see, and it's going down this way. As we pull that tooth up, it'll be right, bring the roots right up beside the bicuspid. There, that I'm showing just a drawing of that, how that root is brought forward by an arch wire, and you just come out, you don't do this, you come out and you bend it down and make it like this, and now this part comes off. So when you pull this up, it tightens this spring, and this wants to bring that, and you can tie from here back against the tooth, and it'll bring the tooth forward and bring the roots right with the tooth. Now that's a big trick. If you learned how to do that, you'll spend your time doing good. All right, we're doing the midlines off a little bit, but maybe the tooth size may be off, and this is 87. And we go through, we've almost got the space on the bottom closed up now. Now the midline is on. A little bit of space left over here, and this tooth here needs to rotate a little bit better, and it will. We tie that off real good. Now this is 1988. and we've lined up in the bicuspids. Everything looks great up above at this point right here, and down here we've got just a wee bit of space between the second molar and the bicuspids. And here the young lady, we finish her up. We left this on till I got a 3 to 3 on the bottom arch down here. Midline's off a little bit, but there's probably some difference in the size of the teeth in there, which bring that back. But as long as we got the interdigitation of the teeth, and the cuspid's coming right down in this, and this, if you looked at it from over here, is doing good too. All right, we got the lower finished now. This is the second molar, and she's young, and the wisdom tooth hasn't got up there yet, so you have to hold the upper tooth up, the upper second molar up, while you wait for the tooth, the wisdom tooth to erupt into the mouth. We should show a molar. The third molars, and these are second molars here, or jam up against that. And here is the facial structures, a smile, and she'll wear, this is not, we've taken all this off now before those pictures. Sorry, we're going to have to go back, and I'm going to keep those deals. All right, I hope you realize what we've done in this case. It's corrected a lot of problems with the upper arch as far as bringing it forward to correct that. It corrected the class 3 situation too. Thank you for watching, and I hope you listen to some of our videos now and join our group and subscribe to it. And I hope that we can show you a lot of other things that you can do, and you do not have to worry about the bone structure. If you just ease those teeth through, the bone follows the teeth. So I'm going to say goodbye, and we'll check out. Thank you for watching.